We are often asked which technique of hair transplant surgery is the best and which has got the best outcome. There are basically two kinds of techniques which have evolved over a period of time for doing a hair transplant surgery. The first one is the FUE technique and the second one is the FUT technique. The difference is how we are going to be harvesting the graft from the donor area. In the FUT technique, we take a small strip of skin along with the hair, we slice it up outside the body, and then single follicles on the single hair are taken and they are grafted in the recipient area. The wound here is closed with the sutures and allowed to heal. While when we talk about the FUE technique, so we use small punches of diameter about 0.7 to 0.8 millimeters. We go in and punch out multiple thousands of these hair grafts from the back of the hair, take it out and then directly put it into the recipient area or the front area. Although there are a lot of variations which has come out, like the direct hair transplant and all, but they're all variations from these two basic techniques. Now, both the techniques have different indications and different ways how it is to be done. Like, for example, if somebody's donor is weak, that means he doesn't have many hair grafts in the donor area, probably a FUT would be a better indication when we harvest the strip, because when we are harvesting the strip, every graft which we take out from the skin strip is ours and we can utilize it into the recipient area. While when we do a FUE technique, we actually have to punch out one and then leave 2 or 3 grafts, and then we punch out the second, and then we leave 2 or 3 follicles, and then we punch out the fourth one. This is how we are going to be doing. If you don't do it, what happens is basically we kind of make the donor area look sparse. Okay, so that's why when we see the donor is weak, we go in for FUT or a combination of FUT with FUE, and the donor is good, we can always go in for FUE. Although it is said that FUT is basically it gives scar while FUE doesn't give scar, but I really do not agree to this, because of course with the FUT you are going to be seeing a linear scar, but with FUE you really see some punched out small scars when we actually trim the hair in the donor area at a later stage, maybe after 2 years or so, when we need to go back and do a second stage surgery, we see those small hypopigmented scars there. Okay, so it's basically wrong to say that one is a scarless procedure and the other one gives scar. Although when we do a FUT, the problem is it's little invasive surgery, so patients may not want it. The discomfort is a little longer than what we do FUE, but as I said, every procedure has got its own indications. So now coming to the point, which is the best technique? See, both techniques are good in their places, and both the techniques have got their own indications, and both the techniques ideally should be considered actually when we see the patient and the patient's condition when the patient comes to us for hair transplant surgery. So I personally feel it has to be customized, and it is definitely depends on the patient's donor area, rather than we close our eyes and comment, okay, so this technique is wrong or not advanced and this technique is right. So I consider that both the techniques should be in our armamentarium, and depending upon the patient's requirements and what we can deliver, we should consider. Thank you for watching our videos. If you have anything to understand more in hair transplant surgery, please do get in touch with us. And if you really want to see and understand more of facial cosmetic surgery, please do follow our videos, and you would be updated with lot of other cosmetic surgical procedures and videos. Thank you so much for watching.